Okay, well, I've had hearing loss my whole life, and my hearing loss was discovered when I was about 5 years old by accident, because I'm one of 3 children in my family who had hearing loss, and they brought my younger brother in to be tested because they had concerns that he had hearing loss, and after they diagnosed his hearing loss, they came out to the waiting room where I was hanging out with my mother, and they said, we want to test Stephanie too. And at the time, my mother said, we have no concerns about Stephanie. She's very talkative. She hears us from the other room. And they said, that's okay. We just want to check anyway. And they did discover that I had hearing loss. So about a year later, I started to wear a hearing aid in 1 ear.
How old was your brother when they tested him?
He was about 2.5 when he was diagnosed.
So he was 2.5 and you were 5.
I was right.
And they hadn't...
Yeah, back in those days, they didn't automatically test the siblings, and of course there was no such thing as universal newborn hearing screening. So there was no way of catching people. My older sister was 4 before she was diagnosed with moderately severe hearing loss, and her loss dropped to profound within 2 years. She attended mainstream schools, we all did, and we didn't have people like Kathryn Wilson. We had a front row seat. At least I did. My sister and brother had some therapy to learn to speak better. But because I had better hearing as a child, I had developed language, and my loss was progressive. So over time, my hearing loss got worse. And by high school, I had said to my mother one night, when it was bedtime, I said, you know, Mom, do you remember you used to just talk to me and I could hear you? And then I kind of started to say, shout in my ear, I really need you to talk louder. And have you noticed now I'm going, Mom, I got to see you. And she says, oh my goodness. And I mean, we would hate to be an audiologist this day and age where we let someone go 5 years without having a hearing test. But that's what happened. So my hearing was probably dropping just very slight amounts. I was a straight A student in school, so there was no reason to say,
suspicious that there was anything.
I had good coping strategies, and those served me well in my life. And so I did get a second hearing aid in high school, started wearing 2 hearing aids, and went to college with a note taker. That's it. And college was hard. I went to Boston College. It was a very competitive school. I had a note taker. I was in the honors program. I did a decent job. But I worked so hard to get the material that I needed to. And it was not until I was 30 years old when I moved to North Carolina for my husband's job that I learned what an FM system was. I met Jack Rausch's wife, Pat, who was working at a facility in Durham. And I was going there to observe her because I was interested in getting into audiology. And she demonstrated this device to me, and I said, oh, that's for people who just have a little bit of hearing loss. She says, no, Stephanie, this is something you could hear with. And she put the FM system on, and she walked down the hall, and she was talking to me, and it was as if she was talking right in my ear. And I started to cry because I was 30 years old, and no one had ever talked about this device. And it had been around when I was in college. I could have used this. So I was very interested in getting into audiology to help people who had hearing loss. And I graduated with a degree in business from Boston College and tried for about 6 or 7 years to break into the field. But everyone said they did not know how I would do it with my hearing loss. How could a hard of hearing, almost deaf person become an audiologist? And then I met Jack Rausch, who was the division director for our program. And I came armed with my transcript from BC and my resume with all my work experience and sat down and talked with him. And he said, we need more people like you in the field. We need people who understand what it's like to be on the other side of the window in that booth. He said, we'll get around those little logistical things. And we did. And I worked in the field for a little while, private practice setting for another audiologist. And then I came back to UNC 2 years after I graduated with my master's. And hearing loss continued to change. I continued to have a little more hearing loss. But I was in the best job I had ever had in my life because everybody that I was around completely understood what my needs were. And I got to the point where I could not use the telephone at all. So probably for the last 9 or 10 years of this job, I've been here 10 years, maybe 9 of those, I've not used the telephone because my hearing had gotten so pronounced. And knew I needed a cochlear implant probably 5 years ago. I was busy having children, and the time was running out to do that. So I said, as soon as I get done having my baby, I'll get an implant. And so that's what happened in April of this year. I went in and had the surgery done by Craig Buckman at UNC Hospitals. 90 minutes, I think.
That was fast.
In and out. And the recuperation was amazing. 5 days later, the bandage was off, and he said, we could map you this week. And I said, no, my brother is flying down for the mapping, and he cannot come until May 18th. So we have to wait. And my brother actually got a cochlear implant 8 years ago, so I knew of what could be possible with the implant. And so it was really kind of nice. I went to my brother's mapping 8 years ago, and so he came down for mine. And it was very powerful. People who saw the videos and the media that were put together for that story often looked at it, and if they didn't know me, thought I had tears of joy at the beginning of the clip when they activate the sound. And I actually was just mortified about what I had done, because everything was so different from what I remembered sound being like. And I just had a moment of, oh my gosh, is this what I'm going to hear for the rest of my life? And I was very fortunate, I think because I had better hearing. When they activated the implant, someone said something across the room, and I think Kathryn could attest to whether this would happen or not, but most of the time, I think it's difficult for people to understand words the very first day you're activated. And someone had a whole sentence that they asked, and I understood it. And if that hadn't happened as quickly as it did, I think my first moments would not have been quite as positive as it turned out to be. But somebody asked what we were having for dinner that night. And I said, did you ask what we're having for dinner tonight? And so I was just very excited to be able to put these words together, and I wasn't looking at someone. And I hadn't done that in a long, long time. So it's been a great experience, and I've been enjoying working with Kathryn Wilson and Melody Harrison from the division on learning to hear and learning to focus and listen to sounds. I'm using the phone a little bit more, and I'm listening to a book on tape now in the car, which has been very exciting because I have a 20-25-minute ride in and out every day, and I like to be productive, so I'm listening to a book on how to be more productive. So that's my story as far as my cochlear implant. It's been a wonderful, wonderful experience, and as an audiologist with hearing loss, I always knew this was out there, and I know that there are lots of solutions for people. So for people who are not sure if hearing aids or FM systems or cochlear implants would help them, I think they need to just go and find out and talk to the right person who knows about it, because there's so many options for people. And that's the part that I think made it good for me, was that I got in the field and I always knew I could try this, I could try that, and was willing to.
Well, we started shortly after she referred to getting mapped, and that's just to create a program on her speech processors, and then she gets remapped periodically. So we started shortly thereafter, and the other aspect, I think, all of us being part of the Division of Speech and Hearing Sciences, is that we have involved students, both graduate students and undergraduate students in this process. So it gives them a unique perspective. Some of them either have Stephanie as a professor, or will have, or have had, and then they come in and get, to do some of the interventions, some of the therapy.